Welcome to another episode of the Mama Doc Baby Doc podcast. Um, whether this is your first time listening or you have been here before, I'm so glad that you are here and spending time with us today. I am Rachel. I'm a pediatrician, and I'm here with my mom, who is an OBGYN. Hey, Mom.
Hi, Rachel. To all of our listeners out there, I want to say if you have a question for us or a specific topic you'd like us to address, feel free to send us a message. We're on Instagram at MamaDocBabyDoc. And in this episode today, we're going to talk about CMV and particularly CMV infection during pregnancy. Now, CMV stands for cytomegalovirus, CMV.
Yeah, CMV. So, in this episode, our listeners are going to learn what is CMV, how is it transmitted, how can it impact your pregnancy, how is it diagnosed, and then how it can be prevented or treated.
Right. So let's get to it. So, CMV is a common virus that can potentially have significant implications during pregnancy. It belongs to the herpes virus family, and that's actually a huge family of viruses, and it's pretty widespread. Many people are infected with CMV at some point in their lives, and most often without even knowing it, because typically it causes either very mild symptoms and sometimes really not many symptoms at all. In people that are healthy, that is. So it's potential that you could have it and not even really know that you have it.
Yeah, exactly. So, how's it transmitted? How do people get it?
Well, it's transmitted through close contact with bodily fluids from an infected person. So you get it from contact with saliva, so it can be spread through kissing, especially when in contact with the saliva of young children who are common carriers of CMV. You can get it from changing diapers or touching objects that are contaminated with the urine of an infected person.
Yeah, exactly. So if you are a mom and you have other little ones, you
Yeah.
actually are at high risk for getting CMV infection. And if you're pregnant and you're around your little ones, you can get CMV during pregnancy. If you have tiny babies, you know that, or toddlers, that they love to give you their slobbery kisses and cough in your face and just be in your face 24/7.
Right, right, right. Now, you can also get CMV through a blood transfusion or contact with infected blood. So, an infected mother can transmit CMV to her baby through breastfeeding. It's also present in semen and vaginal fluid, so it can be transmitted during sex with an infected person. It could be transmitted through an organ transplant from an infected donor, especially if the recipient has a weakened immune system. And less commonly, it can be transmitted by touching a contaminated surface and then touching your mouth, nose, or eyes. It does survive for very short periods on surfaces. And then, of course, it can happen with mother to child transmission. That's a mother to child vertical transmission during pregnancy and also at birth, right? During pregnancy, a woman who's infected can pass the virus through her baby through the placenta. And at birth, obviously, the virus can be transmitted to the baby during the birth process through contact with mom's vaginal secretions, right?
Yeah. So, talk a little bit about what happens with CMV during pregnancy. There's two types of infection. One's a primary infection, and one is a reactivation, a reactivated infection, where you previously had it and now it's reactivated. So, talk a little bit about that.
Right. So, if a woman contracts CMV for the very first time during her pregnancy, that's called a primary infection. And this is one of more concern because it's a higher risk of the virus being transmitted to the baby if it's a primary infection. A reactivation is when a woman who's already had CMV before experiences a reactivation of the virus during pregnancy. And there is a risk of transmitting CMV to the fetus in those cases, but it's lower compared to a primary infection. Now, as far as the risk of the baby to CMV, when a baby is infected, a baby in the womb is infected with CMV, it's known as congenital CMV. And that is one of the most common congenital infections. And it actually affects about 1 in every 200 1 in every 200 babies that are born.
Yeah. So approximately 90% of newborns with congenital CMV are asymptomatic. Only 10% are going to have symptoms. But both symptomatic and asymptomatic newborns are at risk for potential adverse outcomes. Just the symptomatic newborns are at higher risk for those adverse outcomes. So some of the issues that can develop around congenital CMV are hearing loss. In fact, hearing loss is the most common issue that develops. It occurs in 30 to 50% of symptomatic infants with CMV and about 20% of asymptomatic infants.
Wow.
Yeah. And that is actually why when a baby fails their hearing screen at the hospital, they're automatically tested for CMV. Judah, my son, failed his hearing test at the hospital, and they automatically tested him for CMV at the hospital. It came back negative, and most of the time it does, but we just, want to double check and be sure. So everyone who fails hearing screen will get that test done in the hospital. Congenital CMV can also cause vision problems. It can cause intellectual disabilities, microcephaly, which means your head is tiny, seizures, and liver, spleen, and lung issues as well. And when we talk about that small head size too, if your baby is born and in the hospital, they measure its head and it's on the smaller end of the spectrum, they're also going to test your baby for CMV as well. So
perfect. Okay, so now let's talk about how we diagnose CMV. I mean, it might be suspected in pregnancy under the following circumstances. So one is if you're pregnant and you have flu-like symptoms. Okay, so who doesn't get flu-like symptoms at least once during
yeah.
pregnancy, right? So,
Every time.
although many, many women with CMV don't have any symptoms at all, some get this mild flu-like symptoms, and that would include things like fever, sore throat, fatigue, swollen lymph nodes, muscle aches. So if you have those symptoms during pregnancy, especially if they persist and they don't go away quickly, then CMV could be a consideration. Another time that we may suspect CMV in pregnancy is if an ultrasound of the baby detects some unusual findings. And some of these unusual findings could be something called fetal growth restriction, where the baby is not growing as well as we anticipate, or things like microcephaly. If we detect a very small head size, on an ultrasound of a baby in utero, we could suspect CMV. Also, enlarged organs, particularly enlargement of the liver or the spleen. And if there are abnormal fluid accumulations in the baby's body, that's something called hydrops fetalis, where an abnormal amount of fluid could be surrounding different organs or under the skin. Sometimes there is something called ventriculomegalencephalopathy found on an ultrasound, which is an enlargement of the fluid-filled spaces in the brain. All of our brains have little ventricles that are filled with fluid, and sometimes those fluid-filled spaces are too big, and that can be associated with CMV. Also, intracranial calcifications that show up as white spots on the ultrasound in the brain. Sometimes those calcifications are abnormal calcium deposits in the baby's brain. They could indicate a possible CMV infection, and they're not that unusual to find. And then finally, if there are changes noted in the placenta, such as like a thickening, that can possibly also raise suspicion for a CMV infection.
Yeah, it's so much that you're looking for on those ultrasounds that could
Right,
clue you in that there might be an issue. Another
right,
way that we may suspect there's an infection with CMV during pregnancy is if there's a known exposure, right? So if a pregnant woman
right.
has been in close contact with young children, particularly in daycare settings where everything is shared with everyone else,
Right.
um, or if someone has CMV and you were in contact with them, then your risk of contracting CMV is going to be higher, obviously, if you have an exposure.
Right. And also, of course, if a woman has recurrent or prolonged viral type symptoms during pregnancy, especially if it's known that she's had an exposure to CMV, then testing might be warranted.
Yeah. So talk a little bit about testing during pregnancy.
Sure. Okay. So the way that CMV is diagnosed is a blood test, and that test will give us a clue as to whether or not this is a new infection or an old reactivated infection, depending on the type of blood test results that we get. So we test for antibodies, and in particular, different antibodies, IgM and also IgG antibodies. So a positive CMV IgM antibody test is going to indicate this is a recent or current infection, because the IgM antibodies are typically produced early in an infection. Now, if a patient is positive for CMV IgG antibodies, that's going to indicate a past exposure to CMV and may not indicate a current infection.
Yeah. So the CMV IgM being high means there is a new or current active infection. And if you
Right.
see your test results and they say the CMV IgG is high, that might mean you have an old infection, an old exposure, and it may not mean that there's a current present infection at that time.
That's right. That's right. So then to confirm whether or not it's CMV that's affecting the baby during pregnancy, like if we have this abnormal finding on ultrasound and we want to know if CMV could be causing it, then we can do an amniocentesis to sample the amniotic fluid. And then the fluid from around the baby is tested for CMV DNA, which is highly sensitive to detecting the virus in the amniotic fluid.
Yeah, and just so we're all clear, if you have a baby that is born and they are worried for some reason, whether they fail the hearing screen or their head is tiny, that they might have CMV, they're not going to draw your baby's blood or do anything crazy. Usually it's either a urine or a saliva test in the baby. I've never worked anywhere where they do a blood test. There might be some places where that's the only option available, but usually it's urine. And then more recently, there's been saliva tests, which is really nice. So you literally just have to swipe in their mouth. You don't have to wait for them to pee, which has always been the thing with the urine test, waiting for the baby
Right.
to pee.
Right.
So, Mom, talk a little bit about how do we prevent CMV? How do we manage CMV when we think that a pregnant mom might have CMV?
Right. So, as far as prevention, really the best thing that you can do is practice good hygiene, frequent hand washing, especially after contact with young children, as they are often the carriers of the virus. And we generally do not do routine screening for CMV during pregnancy. That's just not commonly done. It might be recommended in really high risk cases, but it's not something that we routinely do. And then, as far as treatment during pregnancy, unfortunately, since it's a viral infection, we really don't have a lot to offer except following the baby's growth by doing serial ultrasounds to see how the baby is growing and developing. Now, after birth, there are some antiviral medications that may be used to manage CMV in newborns if they have severe symptoms, but we don't use those medications during pregnancy. I've never prescribed those medications at all. And then just a word about my experience with CMV in pregnancy is over my 20 years of practice, although it's common based on the data, it happens 1 in every 200 pregnancy. I personally have not seen it affecting babies very often at all. I've
Mhm.
seen it suspected based on ultrasound findings, but it's very rare to have it confirmed. So I don't want you to think that this risk is incredibly high, having like serious problems or complications from CMV, because I don't think that's the case. It is something that you should be aware of and something we need to keep an eye out for because it could happen, right?
Yeah, I was going to say the same thing. That statistic of 1 in 200 pregnancies kind of is shocking to me because I haven't seen it that often either. I have had a couple times where I've seen it, and really what we do with the babies after, if they test positive, is they follow with an infectious disease doctor, and the infectious disease doctor will kind of look for all of the possible complications and kind of help you manage things as they go along. But I agree, I've not really seen this happen a whole lot, maybe 1 or 2 times um, in the whole time I've been taking care of babies. So,
Okay. Okay. All right. So there you have it. Wash your hands, get your ultrasounds for screening when indicated. And although CMV is common, it's not a common cause of problems for babies.
yeah.
Okay. Right.
Yeah, it
Yay.
must be that out of the 1 in 200 that most of them are asymptomatic, I
I
hope.
think that's true. Most of them are asymptomatic. Right.
And
Right.
actually, I was gonna say, Mom, too, I have recently heard that they're working on a vaccine for it.
I have too. Yeah.
And there are some trials you can get into if you are wanting to get pregnant for CMV vaccine. So you can look into that if that's something you want to do. But that's all we have for today. Be sure to subscribe to
Yay.
the podcast wherever you are listening to us right now, so that you'll have access to all of our episodes as soon as they are released.
And also, we would love it if you would leave us a review of the podcast, especially if you're on Apple Podcasts. I love to hear what you think about the show, and it also helps other women find us. It helps the show to grow. So if you have questions that you want us to answer on an upcoming episode, shoot us a DM on Instagram. We're on Instagram at MamaDocBabyDoc. Have a great week, everybody, and we will see you next week.
Bye.
Bye.